but we did do this demonstration during the July WSCAP directors meeting, and everyone seemed to be really excited about this. So we've gone ahead and launched and moved forward with setting up this data system you're going to see for Washington to be able to utilize to help with collecting data for grant writing purposes, CNA, all of those things where you're looking for data, and we can customize this. We have a work group put together that will be helping guide what that customization looks like. But this is really a really exciting tool. We have a few other states in the country using something similar to this, and the National Community Action Partnership has a system similar to this on their website as well that folks have probably used in the past when gathering data for needs assessments. But like Jamie would probably share, that system is an inch deep and a mile wide, and we're trying to, go a mile deep for Washington. So, so hopefully that gives you some perspective as to what we're trying to do here. And this is all geared towards us working forward on creating a statewide CNA for Washington. So with that, Jamie, I'll let you go ahead and get started.
Okay, great. Well, thank you so much, Megan, for that kind of level setting there. I think it's helpful for everyone to understand some of the engagements that we've had with other states, and then also the national CAP. So just a really brief introduction. So my name is Jamie Kleinferge. I'm with the Center for Applied Research and Engagement Systems, also known as CARES. We're housed at the University of Missouri. We're a center here on campus, and we just recently became part of Extension here on campus as well. That being said, we don't really do all that much work with the university, but we do a lot of work with groups out all around the country that range from community action agencies to hospital systems, community organizations. And so I'm going to demonstrate some of the work that we've done across some of the community action agencies today. The first thing that I want to show you, and just if someone could confirm that you guys all can see my screen.
Yes,
I can.
Great. So the first thing that I want to show you here is just the CARES Engagement Network. So the Engagement Network is, if you've ever used or been familiar with Community Commons, the Engagement Network is the sort of a replacement to Community Commons. So the Commons is run by a nonprofit organization, and they decided about a year and a half ago to take Community Commons in a little bit different of a direction, become more of a resource aggregator function, and focus less on providing data and tools. But here at CARES, what we realized was there were a lot of people who were really reliant on the data and tools that we provided through Community Commons. So we do provide a public CHNA, or Community Health Needs Assessment, with about 100 indicators in there. And then just our general mapping tool, which has about 20,000 data layers. And so we have use case stories from all across the nation of folks who have used this in a variety of ways to help, as Megan mentioned, write grants, do community assessment work that's either required or not required. A lot of hospital systems use it because they are required to do community benefit work every 3 years for the IRS, and then obviously community action agencies who are also required to do some community assessment for their CSBG dollars. So we decided to build the engagement network, as I mentioned, as a replacement to those functions and tools that were on Community Commons, and we launched that earlier this year. So you can still get to those two major components, the make a map and build a report. I'm not going to show you these, but I just wanted to make you aware that they are available. These are public tools that are free to anyone to use, and in our new system, you don't have to have a username and password in order to use them at all. So that's engagementnetwork.org. On here is also our hubs, though, because that was one thing that we hosted on Community Commons, were these sort of private spaces for groups like yourself that wanted to go a little bit deeper, take a deeper dive, bring in some more local data, have a custom tool built. We house those within what we called hubs. And so we've been transitioning all the hubs out of Community Commons over to the Engagement Network. So if you're interested in what folks are doing outside of the systems that I'm going to show you today, come visit this hub directory. You can visit each of these hubs. Some of them do require a login, but there are things like the SNAP-Ed Hub, which focuses just on nutrition and health indicators. There are things like Rochester, where they focus just on health in the Rochester region in New York. We have Health in Appalachia, which is a great hub that has a set of 41 indicators that are specific to the Appalachian region, and a disparities report there. Food policy group, so a really wide variety of folks that have transitioned over to the engagement network. And they all, you can see down here, learn more about the tech behind this hub. You can see what kind of custom tools we've built for them and kind of see what those possibilities are. So with that, I will go ahead and I'm going to move this Zoom thing. I'm going to show you really quickly. So this is the National CAP report. Hopefully you guys are all familiar with it or have used it. But as Megan mentioned, it's really just a baseline report that they've created that is county level data for all the counties in the greater United States. So here you can see if you click on create a new assessment, you can select the state that you're interested in. So here we'll go down to Washington, just as an example, and then I can select one or more counties to add to my report. So as I get into the data indicators, this is where you'll see a lot of variation in the state level reports that I'm going to show you after the fact. But as mentioned, this is really just a baseline report. We have a lot of demographics, things like child poverty and other types of poverty rates, unemployment, different types of unemployment rates, educational attainment. We've got a few housing-related indicators. We just recently added some eviction lab data, which the National CAP was very excited about getting, income levels, nutrition, and healthcare. So you can see this is a pretty skinny set of indicators, but really foundational for doing a good community needs assessment. So I could select one or all of these indicators. So I could select an entire category like housing, or I could select just one indicator within any category that I'm interested in, and then click reports. So you'll see this in the other systems as well. We have a couple of report output options. So the one that's going to be most utilized is this comprehensive report. And you have a couple of options here: show data for each county, show data by population groups, and then show maps when available. This show data for each county is really great and very important, I think, to the work that you guys do, especially when it comes to targeting vulnerable populations. When you can see the data broken out for each of the counties, you realize, well, one county is doing pretty well, but another county is not doing so well. That helps you guys identify where you should spend your time and your dollars and your resources. So I'll demonstrate what that looks like. These population groups are race, ethnicity, gender, and age. So anytime we can acquire and show data for those specific population groups, we do that, because we also know that having that sort of more granular information about different racial groups or different age groups can also be very helpful when targeting interventions. And then show maps when available. And this option is really useful if you're going to print a report, especially if you're going to print it in black and white. Black and white maps aren't very exciting, so you can just take them out of the report. We also have a quick facts report, which is just a series of data tables. We have the opportunity to export data to Excel. And right now we are working to integrate back our functionality to export to Microsoft Word. So that was something that we had in Community Commons. We switched over to the new system, and we had to do a little bit of programming work to get that to switch over with us. And so that expected release date is in December for that export to Word option. And then we broke out the source and methodology into an appendix. We did this primarily because in the Community Commons version of these reports, they would sometimes end up being 300 or 400 pages long because we had so much source and methodology information for each of the indicators. We understand that that's really important, but it's also nice to just have it as an appendix rather than part of the initial report. So we broke that out. So I'm going to go ahead and just open this report. You can see here I've just selected 3 random counties in the Washington area. And so this looks like the first indicator I've selected here is around housing. So one thing that you'll notice through all of these reports is they really kind of follow a general or a standard flow. You have the indicator name here, and then we have a dynamics, what we call a STEM sentence. So you can see here that it says, the median age is in 2016 for the report area are shown below. So you can see for the report location and then for each of those counties. So one thing to note here in this data table, it's a representation, of what's set up here in STEM sentence, but you get this aggregate number. So anytime you see a report that says report location, you're going to see that it is the aggregate of the 3 counties that I've selected here. If I were to select 2 counties, it'd be the aggregate of those 2 counties. If I were to select 5 counties, it would be the aggregate of those 5 counties. But then we can also see the breakouts for each county themselves, and that really helps us to do comparison. One thing that we've also learned is that everybody loves to compare themselves to the counties next to them. So this allows you to do that as well if you kind of want to see how well or how poorly you're doing in comparison to the counties next to you. Or maybe you have an identified peer county, a county that has a similar population, a similar racial makeup, similar unemployment rates. You can use that peer county identification to also do some comparison as well. Under each of these tables, we also have a link back to the original source. So you can see here that this is from the 2012 to 2016 5-year estimate to the American Community Survey, and you can get back to that original source or show more details in a pop-out if you were interested in more data background or the methodology. Anytime we can display the information in a map, we'll do so. So you can see here that we've got a map of these 3 counties that I've selected, and I can click this View Larger Map button, and it's going to take me into the map room where I can then interact with this information if I'm interested in doing that. I'll spend a little bit more time in the map room once we get through the reporting tool. So as I scroll down, though, you can see again it follows, each indicator follows that same flow. There's the indicator name. There's a STEM sentence that tells us specific values for the selected area. We have the report location, and then each of the 3 counties that are aggregated in this report location. One additional thing that you'll see here over on the right-hand side is this dial. So anytime we can include the dial, it's kind of just a nice quick representation of the data that you're seeing in the table here, and it is interactive, so I could turn on or turn off the state of Washington or the report location. You can see how that changes. So as I scroll down, you can see this is also one where we have another data visualization available. So it looks like percent owner occupied homes in 2000 versus 2016. Again, this is interactive, so you can turn your different locations on and off. It's also important here to note, one thing I skipped over is that we always benchmark to state and national. So you can see here that we have this information for the entire state of Washington and then for the United States as well. So that provides you additional benchmarking. So you can do that county to county comparison, and then you can also do the benchmarking to the state and the rest of the United States. We do have the ability, and we have in other systems, benchmark to something that may be unique to an initiative that you're working through. For example, I know that there's a group that we worked with in California that was really interested in Healthy People 2020 benchmarks, and so we were able to include the HP 2020 information here in this data table, so they could very easily kind of see how their counties compared to HP 2020 compared to their state and the rest of the United States. So you can see here as I scroll down, again, it follows that same sort of flow. You get the data table, a dial, a map, and then if there are additional breakouts or data visualizations, they'll appear below that. We do have this little circle menu or a hamburger menu here at the bottom, so you're able to sort of jump to an indicator very quickly and kind of scroll through the report if you're interested in kind of jumping between indicators. You can see here, this is, for example, free and reduced price lunch. Again, we have our data table, a dial here. And then this is a good example of one that we have available information or trends over time. So you can see here from 2010 to 2016, it looks like we have values for each of those years. So we're able to report that in a table as well as in a nice visualization here. Not all data lend themselves to being report over time indicators. We wish that all data were collected consistently for timelines and uses of methodology and those kinds of things, so we could report every indicator over time. But unfortunately, that's not always the case. And so those indicators that we can do trends over time, though, we absolutely do. So that's just a quick snapshot of the CAP report. You can see that it's pretty baseline. The standard options here, you can see again, you can download this to a PDF. You can share it very easily via email or on social media, because it's super exciting to share this kind of report. You can print or export it right now just to Excel, but like I said, in December we'll have that export to Word option available. So to get into some of the state-specific reports, what Washington is working on right now, here you can see this is an example of the New York hub. And I'm just going to go ahead. Yep.
This is Megan. Can I just take a second? Can folks just try to mute their microphones? We're just hearing a lot of paper shuffling and coughing, and I know not everyone can, but if we could try to do that.
Yeah, I'm going to just go ahead and click mute all.
Okay, that'd be great.
Yeah.
You need to, I know that you also had a question.
Oh.
Can the data include the MSAs also?
Oh, yes. Yeah, so we can break out information to smaller geographies. So really that CAP report is focusing mostly on county level geographies, but I will show you that we do have the capability to do what we call a small area estimate methodology, and that would be useful for MSAs, zip codes, census tracts, those kinds of things. So yes, the answer is yes. There, is that what the chat message was? Okay, yeah, can the data include MSAs? Yep. Yeah, and feel free to chat questions if you guys do have questions, and then we'll also have some time at the end to answer any questions that you guys may have. So you can see here we're now in the New York hub, and so we've been working with New York for a number of years. They're a good example of a group. So really what the CAP, national CAP has done is they've just taken lots of national secondary indicators, so those that are available through federal sources, and use those to populate their report. The going a little bit deeper in the exciting opportunity of having a hub is to really say, what state data or local data can we also include in a report? So we're sort of marrying state and local level data with those national indicators and getting an even better and more granular picture of the communities that we serve. And so you can see here that the navigation looks pretty much the same. We kind of have a standard layout for the CAP organizations, but you guys can get as creative with the design as you possibly want to. We have a lot of flexibility in terms of the design of these hubs, and so if you wanted to make yours more flashy or add more pictures or whatever, you could do that. NISCO was like, we just want a portal and we just want people to get right where they're going, and so they've got a pretty straightforward design, but we're happy to work with you to do to build out something a little more jazzy. So here, the other thing to note is that we are able to pre-populate geographies. And so what I mean by that is when we were in that CAP report, we had you select a state and then a county or a series of counties. Well, you guys all know that you have your agency regions that may cover one county or multiple counties. And so we can actually predefine those for the community needs assessment report. So what you can see here is it says agency region. So as I scroll down here, you can see that these are all of the agencies in the state of New York or that cover the state of New York, and these are pre-populated. If I wanted to still choose maybe a subset of counties or a grouping of counties that's working together for some other project or initiative, I can still do that by clicking this county button and selecting those individually. Or here, I can use this draw my area. And so this is where you get into being able to define, you can tell I'm in Missouri, so Washington. I'll just say Washington. There we go. And so you can predefine an area that you're interested in. So here we don't have MSAs listed, but it is a standard geography that we could pull in here. But for example, I could say I want to select a series of zip codes. So I'm going to zoom in here to Washington and say I want to select, a couple of zip codes in this area, and this report would pull information just for those zip codes. And it, again, using our small area methodology, you would get data out for the zip codes, and you would still be able to see county level data, but then you would also be able to see that more granular data for those zip codes there. So I'm going to go back to agency region though and just pick a couple of these agencies. So again, I can pick one or multiple agencies that I'm interested in. So I want to go through this process again because it does look and feel the same as CAP. And so that's something that we really strive to make sure that all of our systems sort of have the same user experience or user flow. So whether you're in the national CAP report, you're in our CHNA, or you're in, the Washington State report, you know how to use it, right? So they all kind of look and feel and function the same way. So you can see here, just by me opening these carrots, that New York has a lot more indicators than national CAP does. They have things that are unique to the state of New York. So we have things like average daily population counts in county jails and citizenship status. Those are two I know that we get directly from the state of New York. We have things like a child care wait list, and I actually believe that this is one that we leave blank intentionally for folks to be able to fill in themselves as they're completing their report. So that's something else that we've heard as we've worked with the community action agencies is sometimes the data are available only at that local agency level, but it's helpful to have a placeholder in the larger CNA for those pieces. And so we can create sort of a template or a shell for folks to input that data. And as mentioned, with the export to Word option, they would be able to do that very easily and just enter those values once they've exported that the full report there. They have some other, state-specific indicators here. So things like point-in-time homeless, Section 8 waiting list. There's a housing authorities waiting list. They have things like safety net assistant, child support collection. So these are all data that come from from New York specific data sets or data sources. And so again, that's really one of the value adds of having your own hub or having a customized report is you're not just leaning on those national secondary indicators to tell you what poverty or vulnerability looks like in your community. Instead, you're also getting data from local sources so you can see sort of utilization of different types of programs and additional conditions. So again, we have this comprehensive report option or our quick facts, export to Excel, source and methodology. And so I'm going to go ahead and create this report here. So you can see, again, the output looks very similar. We have our locations that we've selected, which are 3 community action agencies in the state of New York. We have our indicator name and then the stem sentence here. And then we have information, so daily population counts it looks like. You can see here, this is from the Rockefeller Institute. That's, again, a specific source for the state of New York. So we're able to pull that in, and it really depends on how frequently that data are updated. We'll pull it in as recently or as as many times as we can in a year, depending on how often it's released. We have things like citizenship status, which is actually an ACS data set, but it's not something that we have part of our public report, but it's something that they requested. And so that's something else that we're happy to work with you on is, are there data sets, at the federal level that are publicly available that maybe we haven't acquired, but you think would be helpful for your community action agency or your community needs assessment. We're happy to pull those things in. You can see here that we have some breakouts for Hispanic citizens, Hispanic non-citizens, those kinds of things. Here, this is an example of that sort of that placeholder. So we have childcare wait list, and so this is when it would export to Word. This is an area where the individual agency would enter those values. It's not something that we collect and pull in, but it's something that individual agencies collect and could input that information as they're creating their reports. Here you can see we have things like point-in-time homelessness. This is from a HUD set that we had. And then here's a good example of safety net assistance. This is something that comes from the New York Office of Temporary and Disability Assistance. So again, it's specific to New York, and it tells a better story, right, about folks that are using assistance programs in the state when compared to sort of those national data sets that give us some of those numbers as well. So this is as I'm scrolling down, you can see also child support collections, nutrition. So you can look at these alongside all of those national secondary indicators and get a better view of what your community looks like. Missouri has also got a hub as well, so you'll see that they have a community needs assessment. And then I'm just really going to focus on showing you then also all of these sites also have a map room associated with them. And so our mapping data engine, we have about 20,000-ish data layers available in our mapping engine. And we can make either all of those available to you, or we can give you sort of a curated subset. So we recognize that folks in your community action agency might never use data related to soil types, or I guess they might use disaster declarations, but soil types is probably a good example. That's something that we have in our data warehouse, but it might not be useful to you. So that's something we could remove and create a more curated list for you, or we could just put it all out there and people could get creative in using the data. You can either browse the data by topic. So we do have a taxonomy that we use. Again, this is customizable, but the Missouri group has just kind of our standard taxonomy that they use. And you can see here that as you click through these categories, you get down to those individual indicators here. So this is things that may or may not be useful to you all. Let me find here some educational, for example, educational attainment. We've got all of these different sort of breakouts from the ACS, and I could add any one or two or three of these to a map depending on what it is that I'm looking for. So I can click, for example, just population with a bachelor's degree. I can also find out more information about this just by clicking that little I button. So I get a nice description, the release date, how often it's released, what different geographies it's available at, link back to the original source, and then just a source description here if I'm interested in learning more. So I have that checked, and I can just go ahead and add it to the map. So here we have the map room. Since we're in the Missouri Community Action Network hub, it's automatically zoomed into the state of Missouri. So you can then start to interact with the data on the map. Right now we're looking at this information by county. So I can click on any county in Missouri and sort of get all of the information related to that data set here. Bachelor's degree, population, percent of population, total, those kinds of things. Over here on the right-hand side, I can change the geography that I'm interested in, though, because this is a data set that's available at a more granular geography. And then I could zoom into a specific area, you know, that I'm more interested in, and again, get that same information based on the location that I've selected. We also have this available as totals versus percent, so you can kind of see how the map changes there. We have it, so this is a nice one where we have information by school district, so you can kind of make some inferences there as well. We could turn on or off labels. We have lots of reference maps available, so things like place names, highways. Highways are always helpful to orient folks. And really what we imagine you would use these maps for, since they're not necessarily required as part of the CNA process, would be for those grant writing opportunities. So you can always put in a nice map along with some text around how many people over the age of 65 actually live in poverty in your area. Or if you were doing a community presentation, these maps are easily exportable into PNGs or PDFs. You can drop them right into a PowerPoint presentation, or you can share them. They're great for social media to kind of start a conversation around, you know, what does educational attainment look like in our community, and how do we start to make it better? There are also some advanced mapping tools in the map room. So we can do things like query the data. So if we wanted to see an area, for example, where you know, the educational or high school graduation rate is less than 80%, we could do a query just by selecting, you know, what we want to see here. So bachelor degree population would be greater than, we'll say 80%. We can run that query and see if anything returns. So we have 31 results here. You can see that they're all lower than that. And then I could show an attribute table that tells me the population, the same information that you would see there in that pop-up as you click through. But this is downloadable into an Excel file, so it's a nice a little reference if you want to. This is more useful if you're looking for things like, I can add housing developments here, and you can see, let's go up to an area that has a little bit more. Here in Columbia, we have some housing developments, and I want to know which ones are where the rent is lower than $300, because I know that that's one of the fields. So average monthly rent, and there we go. I can run that query. It says I have 5 found, and so I can see those 5 housing developments where the rent is lower than $300, for example, if I were interested in helping find, you know, an individual housing, or if I wanted to talk with those specific housing developments about programming, for example. I could do that very easily. So that's just kind of a quick view of the query tool. We also have a select data tool, which allows you to sort of do the same thing. You can select data within an area and get a nice Excel table output from that. Some measurement tools, a mask tool, which is really nice if you're going to be doing presentations and such. So I can highlight just one area. I can get rid of everything around it, or show just a little bit of information around it if I want to. That's nice if you're making a map, again, to put into a PowerPoint presentation. If I wanted to look at more than one layer, you can see I can swipe these things on and off. That's pretty nice. I'm going to turn off these highways because they're making things hard to see. But yeah, you can swipe the layer on and off, so you can see this is nice if you're looking at 2 polygon data sets together. And then we have information like walk scores as well. At any time, I could look at this information, you know, just somewhere else in the world. So I can just say Washington State, and it's going to take me all the way to Washington, and I'm able to see that information there as well, having already saw it there in Missouri. So I can just kind of zoom to wherever I'm most interested in and see that information. So there we go. You can see all those housing developments and the population with a bachelor degree total in that area. So those are sort of the highlights of the system. You can see here with Missouri, again, they have a pretty straightforward interface. Create a new assessment, make a map of your community. A couple of the other things that we do have available, I'm going to go back to New York here. We have, they asked for a poverty report. So this is something that we've done for them as well, that we could do for any state. So they wanted a comparative look at county poverty levels. We also have one for the state as well. So here you can sort of, we have a ranking for each county in the state of New York, percent in poverty ranked by percent. So you can kind of get a nice snapshot of how those look. You can export this to PDF. And then they also produce sort of, you can see a thumbnail of it, this little infographic. And so you can pick a county, or they have some cities that we also produce reports for. So that's also a possibility. So we'll just select any county here, and it's going to automatically produce sort of this infographic report for the county that we've selected in New York. And you can see race and poverty, education and poverty, employment and poverty, and you can export this to PDF. So again, it's just kind of a nice infographic export that folks can take to meetings. I know that they include these in their annual reports and their CNAs. So this is just kind of another example of some of the data work that we can do through these systems. We do have sort of a placeholder right now for the Washington State one, and you can see that it's going to act and function much like the other one. So there's a community needs assessment there, and then also a map room as well with access to those 20,000 indicators. But I'm going to pause and see if there are any questions, or if anybody wants me to spend more time showing more about the report or the map room. And I will unmute you guys because I think I just muted everyone. So everybody should be unmuted. If anybody has any questions, I'm happy to answer anything that you guys might want to see more of. Well, you guys are a quiet group. I know it's early over there on the West Coast, so maybe you guys are all still drinking your coffee. Yeah, so I think that those are just some examples of the community action organizations that we work with. Again, we have that national CAP report. We have Missouri, New York, and then we also have Pennsylvania, which we're transitioning over right now. We're adding Washington, and I feel like I'm missing someone. I feel like there's somebody else. Anyway, lots of different community action agencies on our system, and so we're happy to work with you guys one-on-one to talk about what are those state level indicators that you think would be helpful to include in a report. How can we acquire them? How often should we acquire them? That's really what we're good at, is data acquisition and analysis, and hopefully you can see that, somebody having to do a report like this on their own, where you're kind of hunting down all these individual data sources and aggregating them into a report, can take, hundreds of hours. And here we're able to collect these indicators and do it in just a few seconds or a few minutes, generate these reports, and give you more time to actually do work in a community rather than spending your time collecting data. Which can be fun, but not always. Megan, was there anything else that you wanted me to show today?
I just wanted to touch again on the standard product comes with how many data sets, and then is there a limit as to what we can customize?
Yeah, so basically we have a list of about 300 to 400 indicators that we can include, or that we allow you to select from to include in a report. We typically recommend that you select somewhere between around 75 to 100, no more than that, just because it becomes a little bit overwhelming after you get past 100 indicators. But really that, you could select as many or as few as you want, depending on, what your audience is or what your reporting requirements are. And then when it comes to the individual state level indicators, we'll really work with you on which ones you think would be most helpful. Are they available? How often are they updated? And we usually price those individually. So something that comes from, for example, like your state Department of Health, might come to us really clean, and we might be able to just put it into our system very quickly. But there might be other lists that come a little bit less validated or less clean, and we'd have to do some work to integrate it. And those would be a little bit more expensive, but not too terribly expensive. So you can see here, though, that New York has, I think they have about 10 to 12 state level indicators that they've included. And, each year they sort of revisit this list and decide, are there additional state level indicators that we would like to include? Are there things that people are asking for? One of the things that we've heard a lot this year from folks just all across community actions and hospital systems and other groups that we work with is information related to opioids. And so while we have some good data that comes from CMS, there's not a lot out there related to opioids, but we recognize that could be very helpful to folks. So, we've started to work with EHR, electronic health record data, to get at some of the overdose, types of data for individuals in a specific area. We also just recently started working with a group where we're pulling records from their from dispatch. And so, they have dispatch records that are available. And so we have some machine readable type of technology that allows us to see whether individual calls are related to opioids, so they can get a better sense of where people are, what kinds of opioid use and abuse are happening, how many times Narcan has to be used, or the naloxone, those kinds of things. And so really, we recognize that there are issues like that crop up, and that having data around those types of issues would be very helpful. And so we're always happy to revisit sort of those state level indicators that may be interested to you all.
So for those of you on the phone that are in Washington, part of our work group, if you haven't joined it, part of our work group's job is going to be going through some of those state level indicators and determining what our customized report is going to look like. So if this seems interesting to you and you'd like to be a part of that, please contact me online, and we'd be happy to put it in our group. Are there any other questions for Jamie? Or Jamie, are there other things that you wanted to share with us today? I see a comment also from Rebecca, really liking the poverty report template, thinking it would be very beneficial for CAPs that don't have that visually represented report tool. So I agree with that. Thank you for that feedback, Rebecca.
Yeah, not too much else to share. Just keep in mind that, like I mentioned, some of the customization options, around those custom geographies, things around something lower or smaller than a county level is all available. We're happy to work with you and determine what's going to be most helpful, whether you want MSAs or city level or some track level groups. We're working with Washington, right now there's some areas in King County, they don't serve all of King County, they just serve certain zip codes within King County. So creating or delineating those custom geographies is definitely a possibility, along with the data indicators. And then I really wish I had the export to Word to show you guys, but just imagine that the report output, all of it comes over, the data tables, the dials, the maps, the data visualizations will come over into Word. And we see that as really powerful, because then you can add some local context in there. You can add text or pictures. stories from the community, whatever it may be, to really round out that CNA, product as a full product in the end. So I think that's all, but we're happy to, answer any other questions. If you guys, you're welcome to play around in these systems. And if you have any questions about the data or, setting up a hub or anything like that, you can reach out to me directly. At the bottom, there's also info@engagementnetwork.org. You can email that address and I'd be happy. I will likely answer it as well. So yeah, I think that's all we've got for today.
Great. Thank you, Jamie. So we'll close here, and if other folks want to stay on the line and ask some questions, you can do that. Otherwise, reach out to Jamie via email or to myself. And everyone have a great day and a happy Thanksgiving.
Yeah, sounds good. Take care.
Thank you.
Thanks. Bye.